A person may want to discuss voluntary assisted dying, also known as VAD, when having an advanced care planning conversation. It is important to listen, be open, and respect their wish to discuss VAD. There are differences between voluntary assisted dying and advanced care planning. VAD is one end of life choice an adult can make. It involves an adult with a terminal illness being assisted by a health practitioner to end their life. To access VAD, the person must have decision-making capacity, meet other criteria, and go through an assessment process. A person who does not have capacity cannot access VAD. Only the person seeking VAD can request it. Their family and substitute decision-makers can't ask for VAD on their behalf. VAD can't be requested in an advanced care directive or other planning document. Advanced care planning is different from VAD. Advanced care planning involves planning for future healthcare to guide decision-making when the person has lost decision-making capacity. The person can discuss medical treatment and healthcare they want or do not want, their values, preferences and healthcare goals, or who they want to make decisions for them when they are no longer able to. The person may record these decisions in an advanced care directive. A person can appoint a substitute decision-maker in their directive or another legal document, depending on the state or territory. All adults can have planning conversations and make an advanced care directive so long as they have capacity. It is important to remember that an advanced care directive can only be made by the person. Their family, substitute decision-makers and health professionals cannot make a directive for them. A valid directive should be followed by health professionals, families and substitute decision-makers. VAD can be discussed during advanced care planning conversations. If a person asks about VAD, it is lawful for you to discuss it. However, if you want to start a discussion about VAD with someone who has not raised it, there are restrictions in some parts of Australia. Before starting a conversation, check the law in your state or territory. Here are some handy tips for discussing VAD during advanced care planning conversations. Be ready for the conversation. Know the extent to which you wish to be involved in VAD. Understand your legal obligations relating to VAD discussions and what to do if you can't participate in VAD. Know your organisation's VAD policy. If allowed by law and it is clinically appropriate, you may raise the option of VAD. Remember, if you raise VAD, you must also discuss other treatment options and palliative care and their outcomes. Take the opportunity to explore the person's values, preferences and healthcare goals. Advise the person that accessing VAD takes time and needs planning early. Give the person details of the state or territory's VAD Care Navigator service for more information. This is particularly important if you have a conscientious objection or can't participate in VAD. For more information on VAD and advanced care planning, access these resources.